Ladies and gentlemen, dear friends, it is an honor to join you today at the World Bladder Cancer Patient Forum, and I am so sorry couldn't be there with you in person. I speak to you as a doctor, as a former European Commissioner for Health and Food Safety, and now as a member of the European Parliament. Cancer touches every family, every community, and every health system in Europe. Cancer is relentless, but science is also relentless, and so is our collective determination to fight this disease. That determination is visible here, in the strength of patients, families, advocates, professionals, and policymakers united in a single purpose to ensure that no one faces cancer alone, and that no one is left behind. During my time as European Commissioner, we made important progress. We strengthened tobacco control. We expanded screening programs. We built European reference network to share expertise across borders. We invested in research and innovation. These achievements save lives every day. But the fight is far from over. Cancer continues to challenge our societies, our systems, and our solidarity. We must see our possibilities to do more and to do it in a more effective and in more coordinated way. We must change our paradigm from reacting to disease to preventing it, from treatment to early detection. And we must remember that the fight against cancer cannot stand alone. It needs a health in all policy approach across environment, employment, agriculture, research, and social affairs, because every policy can be a health policy. Prevention remains our most powerful weapon against cancer. Yet today, Europe spends only around 3% of its health resources on prevention. 3%, a drop in the ocean. We urgently need to increase this amount. Tobacco is still the leading preventable cause of cancer, including bladder cancer. The fact that I know not enough people are aware of. Occupational and environmental risks continue to harm health. Diet, alcohol, and physical inactivity remain major contributors to diseases. We know the causes, and we know that prevention works. Healthy lifestyles, safe workplaces, and clean environment save lives. They also save money and reduce inequalities. Equally, early diagnosis saves lives. We see it in the breast, colorectal, and cervical cancer, where organized screening has transformed outcomes. We need the same attention, the same innovation, and the same urgency for other cancers, including bladder cancer. Awareness of early warning signs, such as blood in the urine, must become part of every national awareness effort. No patient should lose the chance of survival because symptoms were missed or ignored. One of the greatest injustices in Europe today is a difference in cancer outcomes between countries. A patient's chances of survival should not depend on where they live. The same truly applies to all comers of the world. Europe has enormous expertise, experience, and enormous data. The task before us is to connect these strengths, to share, to collaborate, and to make full use of those tools we already have. That means tackling shortages of essential medicines, supporting access to innovative therapies, and ensuring that clinical trials are open to all. It means bridging the gap between East and West, North and South. Solidarity is not a slogan. It is foundation of the European project that in health, solidarity saves lives. Getting on top of cancer requires investment in research and innovation. Europe must continue to support new therapies, precision medicine, and cross-border network of expertise. Through Horizon Europe and future research programs, we can drive discovery and bring it faster to patients. But we must also remember that the cancer journey does not end with treatment. Survivorship matters. Continence, sexual health, nutrition, mental well-being. These are not secondary issues. They define quality of life after cancer. And patients must be partners, not passive recipients. Their experience, priorities, and insights should shape how we design care, conduct research, and measure success. When patients are involved, policies are stronger. Invitation is very important, and innovations become truly patient-centered. Bladder cancer offers a powerful example. It is one of the most common cancers in Europe, yet still too often under-recognized. Patients face late diagnosis, treatment shortages, and challenges that affect daily life at work, in relationship, and in emotional well-being. Improving outcomes for bladder cancer is not only a medical necessity, it is a test of Europeans' commitments to equity and solidarity. If we can close the gaps for bladder cancer in awareness, in diagnosis, in treatment, and in survivorship, then we can show that our system works for all patients. No cancer should be invisible. No patient should feel forgotten. Today, as a member of the European Parliament, I can say clearly, health must be placed at the heart of European politics and Europe's priorities. The next multi-annual financial framework, the European Union's long-term budget, must invest in public health and integrate a comprehensive health approach in all policies. Health cannot be treated as a cost. It is an investment in our future because we are treating patients, we are treating people, and we know how it means save lives. Cancer, including bladder cancer, must remain at the center of European Beating Cancer Plan. And health must be integrated into the European semester and other governance mechanisms so that progress is measured, accountability is ensured, and political commitment is sustained. Prevention, research, and equitable access must be core objectives, not side projects. Friends, throughout my career as a doctor, as a commissioner, as a parliamentarian, my guiding principle has always been the same: the promotion of health, protection, and prevention must come first, and participation of all of us. Our collective determination to fight cancer is stronger than any obstacle. To patients and families, your courage gives meaning to all of ours and our work. To advocate in civil society, your voices ensure that no issue is forgotten. To policymakers and industry, your responsibility is to act with solidarity and vision. If Europe acts together, patients, doctors, researchers, policymakers, then bladder cancer, and indeed all cancers, will no longer be invisible. They will become priorities for action, for investment, and for hope. Today's World Blood Cancer Patient Forum in Brussels is another important step. The knowledge shared here, the partnerships formed here, will translate into better outcomes for patients and their families, and not only in Europe, but across the world. And I wish you big success. And thank you for your cooperation and for listening to me.